Okay, so thanks everybody for joining. We've got a talk being given by Dr. Nada Y. Phillip, who's the Associate Professor in Mobile Health, mHealth, at the Kingston University in London. And her talk is on the Internet of Things for digital health, remote monitoring systems, current advances, challenges, and future direction.
Hello, everybody. Good evening. Many thanks, Matthew, for the introduction. I'm just going to share my slides. Welcome, everyone, for my talk, and many thanks, everybody, for the invitation. The talk will be about Internet of Things for digital health remote monitoring systems. We'll be looking into the current advances, challenges, and future directions. My name is Nada Phillip, and I am from Kingston University. I am an associate professor. My expertise is in the area of data and network and communications, but my research interest has been always since 2004 in the area of mobile healthcare. So we're going to go with an introduction first to look at the factors that contributed to the rise of digital healthcare. And then we'll move into, we'll present some of the current advances in Internet of Things technologies, services for remote health monitoring. Then we'll move into the challenges and recommendations, future directions for Internet of Things remote health monitoring, and we'll finish it up with some conclusions. If we look at the factors that affecting or influencing the rise of digital health care, they are, as you can see in this figure. So we'll start with the advances in Internet of Things technologies as the enabler of digital healthcare. So Internet of Things has been one of the catalysts really in revolutionizing conventional healthcare services. Many thanks to a number of development and advancement, in particular to the mobile technologies and wireless communications. For example, improvement in optimized network architecture, improvement in indoor network coverage, and increased device reliability and performance and capabilities, and also the ultra low cost of devices, and not to forget improvement in power consumptions and energy management aspects, and finally device and network security and privacy. Many thanks for these developments as an enabler for the advancement in Internet of Things technologies. The other factor that influence the rise of digital healthcare is the societal and health needs. We are a growing society, and also diseases evolved. So traditional healthcare systems reached its capacity in terms of providing efficient healthcare services to the population. And this is really to do with the world is facing the aging population and the inherent needs for assisted living environments for senior citizens. So we have some statistics here, as you can see. Population age 65 and over is growing faster than all other age groups. And we have individuals over the 60 years will nearly double from 12% to 20% for the period of 2015 up to 2050. And also 80% of the elderly have at least one chronic disease condition, and 77% have at least two of these, which is a problem, multi-chronic disease. And not to forget also, the other health need is what we have over the last 2 years due to the COVID-19 pandemic. which parallelized access to our healthcare system due to all the regulation and due to the, to the limited resources that we had. For example, hospital beds, staffing, and so on. The other factor that influenced the rise to of digital health is basically the support of policymakers. The support of policymakers, without the support of the policymakers and government in digital health care or in any diversion from the current healthcare module, you need the support of these policymakers and the government. There is such support over the last few years. In particular, there is a support for personalized, integrated, and connected care to support the healthcare service delivery. So this was really, the NHS UK to address these limited health and social care resources. They set out 5 changes to the NHS service models. And these are, in summary, first is boost of out-of-patient care, basically treat patients at home or at care home and avoid it to bring it to the hospital or primary care. NHS redesign, this is to reduce the burden on the emergency services. Empowering patients and personalized care, they are pushing for that as well. Digitally enabled care, which is basically digital health for remote monitoring, for example, and integrated care systems. And if you look at all these factors, really without basically digital healthcare or mobile healthcare or e-health, these are the enabler technology to have these 5 changes or these new service models to become a reality. So these are all based on the digital health and mobile health aspects. Not to forget also, because of COVID-19, healthcare service has been disrupted. We all know that. There were direct effects. And because of that, there were direct effects, and the policymaker and government has to step in and support this. And this is basically providing virtual wards where basically we call it hospital at home, where because of the lack of hospital beds and staffing, they kept some of the patients of COVID patients or patient with respiratory diseases stay at home and provide them with some sort of remote monitoring, for example, SpO2, for example, to measure the oxygen level in blood, and also with some sort of a teleconsultation, like provide them with a tablet or something like that to do the teleconsultation with the nurses or the doctors. And also virtual wards for not just for COVID patient, but also for other type of people, frail people that they have multiple disease, and why don't we just keep them at home and treat them remotely with the technology, with digital health and remote monitoring, and treat them at home or even at a care home. And the other, which we call it indirect effect of COVID-19, some technology appeared because of the indirect effect, because like as a mitigation effort to reduce the increased transmission of the disease, many of the face-to-face like patient-physician model care is changed to teleconsultation via different type of technology, Zoom or different type of teleconferencing systems. So I can see here, yes, like the first point here, which is the set out 5 changes, was there basically to improve care, quality of care, and also reduction in cost. However, the second point here, which is to do with COVID-19, is basically using digital healthcare to provide service. Otherwise, you can't provide it because of the lack of hospital bed or staffing, and people cannot travel because of the lockdown, to reduce the transmission of the diseases. So kind of digital health, we can see two points here. One was to reduce cost and provide better care, and the other one was a necessity. You have to use it, otherwise you can't provide these services, you can't treat these patients. The other factor is the impact of digital health, evidence of the impact of it. This is very important. Like if all the research or project that we do, or the like systems being in place, digital healthcare system being in place globally, if they all provide like results of their studies or the impact of their systems in society, financially, or in terms of improved quality of care and so on. And this is really important because this will encourage other people to follow these steps and learn from these lessons and basically adopt digital healthcare further. So there were studies, like, for example, related to diabetes here, that reported reduction in HbA1c, for example, because of the use of mobile healthcare as compared to a controlled or people without the mobile healthcare technology. And also there was another study, it's proven that using digital healthcare as a main umbrella, or mobile healthcare as a subset of the digital healthcare, is also reduced bed blocking, and also unnecessary appointments here. Another study on congestive heart failure, again, led to lower hospitalization rate and improved mortalities. And these such results, it encourages other people and provide other people with, like, for example, recommendation. How did they overcome the challenges to do these, to apply these digital healthcares in their own healthcare systems adopted. Now, accordingly, there are, like, over the last, let's say, 2 decades, there are lots of application in terms of e-health, mobile health, telehealth care, which is under the umbrella, what we call it now, digital healthcare. There are so many applications in like application of remote health monitoring, really. We have some statistics here. So, for example, according to the global market insight, mHealth market size is set to exceed 289.4 billion by 2025. And there are some other like kind of statistics from the US, where it says that 70.6 million people, or 26%, over 26% of their population, will use remote patient monitoring by 2025. And also related to COVID, if you look at this point, again, this is from the EU, it says like 55% of people of age 16 and 74 reached full health related information over the internet in the first quarter of 2022. So there is like evidence of the rise of such technologies, and adoption of this. But still, there are so many challenges because of this paradigm shift still exists. This needs to be addressed so we can have a scale up and wide adoption of such system, including acceptance and adoption by patient, healthcare provider, and policy makers, which will be the topic of our talk today. Now, before I go into details or look at the advances in Internet of Things technologies and challenges, recommendation, and so on, I thought, like, let's have a look at an example of let's say, Internet of Things based remote monitoring, remote health monitoring. This is a project really related to remote monitoring, or is a really integrated care platform, which I was part of it, to support patients with COPD with comorbidities using wearable sensing and smart cloud computing. And this is like, I put this one here because it's a typical example of remote monitoring systems. So here we have at the left-hand side, we have the patient hub, where we have the application that controls, the communication between the patient, the sensors, and the cloud. So here we have a number of medical devices, because I said it's COPD with comorbidities, COPD patients with, for example, diabetes, heart failure, depression, and so on. So we provided these patients with lots of medical devices, like, for example, a glucose meter is related to diabetes, but also with some wearables that allows to monitor their chest, because COPD is related to the lungs. So monitor the chest, the coughing, ECG signals, SpO2, and so many like physiological signals. This wearable was measuring. Of course, it's all enabled with body area network and with the personal area network, where you connect all these sensors and wearables to the nearby, let's say, tablet here, and that can send the data to the cloud in terms of vital signals, medication adherence, and other type of signals, and also to get a feedback from the cloud in terms of educational information, motivational dialogue, history, diary reminder, questionnaires, and so on. So basically, things about their treatment plan. And we have the cloud communication API to collect all this data and channel it to the cloud in a secure way, an interoperable way. And we have here the cloud, where it has the main component, which is basically the patient record data storage. We had a decision support system, which takes all this data and kind of runs some sort of an algorithm, sort of machine learning algorithm, to predict, like, for example, hospitalization or worsening of the conditions, and so on, and the feature extractions to feed to the decision support system. And of course, we have the portal for the doctor and nurses to monitor their patients and to provide treatment plan and do all the follow-up aspects with their patients. So just to show you, like, the main building block here of such system, which is the patient hub here, the professional hub, you have the cloud, and all the and the communication APIs. This is another example, which again is about remote monitoring, but not at home or at home care or at care home. But here is via 5G enabled connected ambulance. It's another project I'm involved in. And currently we are at the pilot stage with some London ambulance services. Here we have the ambulance, there's a vehicle which is equipped which has some sort of devices that measure physiological signals, and we equip them with some ultrasound systems to scan a patient, and with some sort of video conferencing, like camera and so on, related software, and via the 5G. It's got a 5G router, and all this information again gets to the A&E. To provide some feedback. The A&E will provide some sort of a feedback via such system to the ambulance crew, and perform some sort of a diagnosis based on the ultrasound feeds, and also observe the vital sign for any abnormality and so on. And basically, based on the diagnosis, maybe they needed to refer the ambulance or the patient to another department, saving time, resources, and costs. So again, it's remote monitoring, but with another setting. I mean, over the years, as I said, there has been a tremendous increase in such applications for different type of diseases like chronic disease self-management, diabetes, cancer, COPD, medication adherence, assisted living, for example, for Parkinson, for mild cognitive conditions, and many more. Now, if we want to look at the advances in the key technology of Internet of Things for health remote monitoring, we can divide the key technologies into 5 technologies, or 5 subcomponents, let's say. So we have the mHealth, or the mHealth assistive sensors. So here we have the actual medical devices and wearables and sensors, and we have the Internet of Things communications and networks, for example, related to body area network or wireless body area network in this case, and wireless personal area network. And then we have the middleware, which is basically which one of the components of such system. And we have, or the key technologies, and we have the cloud computing, and finally we have the Internet of Things application. So let's have a look at each of these, let's say, building blocks of Internet of Things systems. Again, there has been an increase in the development of intelligent medical devices, wearable sensors. They came in different types, as bands, as rings, as smart clothing, body attachment, or it could be invasive, like it's inserted into the body, like insulin pump, pacemakers, and so on. So we have a lot of development in this area, and of course these devices, they come with its own, let's say, capabilities in terms of transmitting the signals via the wireless modalities that they have, and so on. So over the years there were a lot of development to have, in terms of getting the devices or the wearables smaller, have the portability aspect, mobility aspect, low in power, reliability, computation capabilities, easy to wear, easy to use. Many of these wearables, for example, this is the vest that we have in the first example that I gave you for COPD patient. One of the problems was with these wearables is that attachment to the body, because with these sensors, if they are not really well attached to the body, you can't have a good quality signal. So again, there is a lot of advances in that. So for example, when the patient moves, these things doesn't move in terms of the sensor, in terms of attachment to the body, and so on. And there is also the advancement in the textile or smart textile, where we call them e-textile, and the aspect and the material used for their conductivity to transmit the signals, and how it's attached or woven together within the textile itself. And not to forget many of these sensors, they use some sort of interoperable, let's say, data protocols, so it can be used. It can be used in a unified approach. You can, it's interoperable with so many, let's say, devices, and there were so many standards for that. For example, here we have the ISO IEEE 11073 personal health data. Many of these medical devices, like glucose meter or blood pressure devices, and also one machine to machine. So these lots of advancement in there in terms of data communication standards, so they are interoperable and can be used everywhere. The other, let's say, the other key technologies, as I said, is the Internet of Things communication and network. And this is mainly related to the wireless body area network, or wireless sensors, and the wireless personal area network. As we know, there are so many it's based on so many, let's say short range communications and long range communications. Lots of advancement happened there to provide, like in terms of increased coverage, in terms of power management, in terms of reliability, and so on. So we have many applications here. You can see it's a good candidate for the Internet of Things, and these include, for example, we know like the Zigbee and the Bluetooth and so on, and also we have the NB Internet of Things, we have the LoRaWAN, and we have the Sigfox. All of these are designed to use low power, wide area networks to enable the connection of a large number of devices at a low bit rate and with low energy consumption and low cost. And not to forget also the latest development in relation to the 5G and 5G Internet of Things and the latest development from the 3GPP standard, again, to provide low power, low data rate, and wide area coverage cellular connection to diverse types of Internet of Things devices, especially in rural, in congested area, in urban areas, because reliability is an issue here. Sorry. And the other key technology is basically the middleware layer. There is a lot of advancement here. This is another example. This is an example. Again, it's from the first project, which is the COPD, self-management, remote monitoring. Again, this is the application at the patient home is being developed. With the architecture of it is like this. We have a number of, let's say, sensors that gets connected either via the body area network, which is the wearables, again, using different modalities, wireless modality, either Bluetooth or Wi-Fi, depends on the type of data that you are collecting. For example, if it is a high data rate data, you should use, for example, Wi-Fi. If it is a lower one, you should use Bluetooth, and so on. And again, there is the issue of energy aspects and so on. So, and we have the personal area network here, which is medical devices, blood pressure machine, and so on, connected via Bluetooth, for example, or Bluetooth low energy. And we have at the top there, which is the application layer, that to use these sensors to collect data from the sensors. So the way it's designed typically in such is by using a middleware layer in the middle there. This is like, there was a lot of advances in this, in this building block technology for Internet of Things, which is the middleware layer. Really, the development was to support interoperabilities. It's designed in such a way that it can allow different type of devices connected to the upper layer applications, and also to support heterogeneous devices. You can bring heterogeneous devices, and also designed in such a way that it allows mobility. It allows mobility, adaptability, better user experience, and also security, all embedded within it. So basically, the role of the middleware layer is to it acts as a service-oriented software layer that allows communication with the heterogeneous devices, like, for example, the sensors and the actuators from one end, and the cloud services at the other end. So as I say, this is one type of architecture. Of course, there are so many examples in the literature that you can follow. But mainly the design or the requirement for such layer is mainly, these are the three points, the one that is being listed in these 3 points here. Now, the other angle here, or the other key technology, is cloud computing. Again, the cloud connectivity is another subsystems, as we've seen it in the example, the first example that I did show at the beginning, which is for the COPD self-remote monitoring. Again, is another subsystem of digital health or remote Internet of Things based remote monitoring systems. So basically, usually such cloud system is to store data, and it has some sort of capability that allows you to run machine learning or AI and so on. And then not to forget, recently there was the development or the concept of fog computing or edge computing. This is kind of to bring the capabilities of cloud computing closer to home, or to the place where are you collecting the data from. And this is basically is important in some cases. So for example, if you want to transfer mission critical data to the cloud, you can do it to this edge computing first, supported resilience, real-time operations, and of course for security and privacy aspects. And anyway, having like the edge computing or the fog computing here in place, kind of to take the advantage of both local and cloud-based services. Of course, cloud computing, you can select from so many. There are so many available for Internet of Things. Like for example, the example for the COPD project that I did show at the beginning. We use the Amazon Web Service, and it gives you different type of capabilities, many of them. So it depends on what's your requirement. You can select. And what's your budget? Of course, you can select the one you like. So for example, you can select it based on the communication protocol that you can communicate with, based on type of security, authentication, authorization, encryption that it can provide, based on the data format support in terms of the API, based on does it have any capability of supporting analytics and so on, what type of programming language and so on. And not to forget also, there are other aspects related to select your cloud services. You need to have pricing, of course, is an important aspect. And of course, these cloud computing, they can provide you the service either as an infrastructure, as a platform, what do you call it? As infrastructure, we call it IaaS, or platform as a service, PaaS, or software as a service. So I just wanted to discuss this. And also, when you design such services, remember, it should provide you the flexibility, scalability, and interoperabilities. Because you never know, to cater for more users, you should have the aspect of scalability and interoperability to connect, you develop something once and you can connect it to any other devices based on the API that you provide and interoperability aspects. Let me see. And not to forget here, we said that cloud computing, and usually what you do there is also you provide, for example, the decision support system that we talked about in the first example of the COPD management or remote monitoring. We have the decision support systems and feature extractions, which is basically there we run some AI algorithms or machine learning algorithms to let's say, to predict worsening of conditions or hospitalization, to create an alarm or to alert the nurses and the doctors about the situation of the people at home. So this is like kind of another example here. So what do you do there is to provide to support the decision of the clinician or the healthcare professional with the right or the personalized treatment for these people. So again, so AI artificial intelligence, machine learning is another, like within the cloud computing, another like enabler technology for Internet of Things. And especially this will become even more, is not just about supporting the clinician, that for example, they can have a tool that it's somewhere in the cloud, they can run some sort of an algorithm there and kind of predict the best treatment for a particular patient. It's not just about that, or do some sort of a visualization, as you can see here, but also in future with the availability and popularity of the remote health monitoring, we will be collecting a lot of data, and it's based on the NHS. And as you know that, for example, if you take the NHS, we have the electronic health record, and we have a huge data that we can use. So for example, to personalize treatment, but also with the remote monitoring and the high adoption of it, this will generate a lot of data that can be used in future really to personalize treatment even further, because here is about daily monitoring of conditions. And also it's not just about to support the clinician themselves with their decision, but maybe you can use the result of these algorithms within the self-management application for the patients to, I don't know, to give them, some feedback about a certain behavior they have, or for example, lifestyle and so on, and to adopt a better, let's say, a better lifestyle to support their conditions. Now, finally, it is the Internet of Things applications that the final key technology. So this is basically the actual application that glues everything together, which is glues the sensors, the wearables, the patient themselves. It's an application run on a tablet. Basically, the best thing is to run on a tablet. It's a bigger screen and so on. And that collect all of this data and also channel it to the cloud. Usually these applications, they are designed and developed with a great user experience, because as you know, it can be used by an elderly, and you want to use them safely and really in easy to learn, easy to use, and also safe. And usually these applications consist of a number of, let's say, modules, we call them. So for example, there could be a measurement one. It could be a measurement that when you press it, allows you to connect to your sensors to measure anything you want, like it's connected to these applications related to the disease. It could be a questionnaire. You click on it, and your GP or whatever person who's looking after you, healthcare professional, provided you with some questionnaires that you need to complete. Or it could be an education, let's say modules. Here you click on it and read something that your nurse sent to you to learn from. This is a diary. Usually these people, they have lots of things. Medication and appointment could be a nice feature to have. Medication, like just to maybe list this medication, or just to check, have you taken your medication, and so on. It could be like something that you can use, like human-to-human capability, which is to allow you to communicate with a nurse or somebody at the other end, and of course to show your history. And of course, usually this application, Internet of Things application, is designed in such a way that you don't need to provide all these modules to all of the patients. It's based on their, for example, capabilities, and are they familiar with technology and so on. So maybe if it is necessary, you can just provide the measurement and the questionnaire for them. If they want, you can. So what I want to say, these Internet of Things applications should be designed in such a way that is modular to suit the different type of patients that you have. So as I said, this allows like device to device, because for example, from the measurement allows the tablet to connect to your sensors, or human to device. For example, a human can complete a questionnaire for the clinician, or a human to human. For example, here the comment option here to communicate with the healthcare professional from the other end. That's the enabler technology. So we just looked at like kind of these 5 5 enabler technology for Internet of Things, and we looked at some advances in that areas based on, some projects, some examples. Now, the next step is to look at the challenges. What are the challenges? Now, in order to frame the challenges in a nice way, we thought that, okay, let's link them into quality of service in distributed systems. There is a standard, or there is, I think this is, there is a model for quality of service for distributed systems. And the quality of service metrics are related to functional stability, performance, compatibility, interoperability, usability, reliability, security, maintainability, modularity, scalability, and portability. These are the main quality of service in distributed system in general. Now, in here, what we've done, we just took these and kind of map it to the Internet of Things system. Anyway, Internet of Things is a distributed system. We've got lots of subcomponents, they are communicating with each other. So we thought, let's go through the challenges based on the quality of service list. So here, we listed these quality of service. So we're going to look into the challenges in terms of performance, functional stability, and reliability, in terms of security, safety, privacy, ethics, and law, in terms of interoperability and scalability. And we don't stop just there, because there is another factor which is not part of this quality of service for distributed system, is the human factor that we need to consider here, and it is a challenge as well. So let's have a look at these aspects. So to start with the performance and reliability, this is of course an important aspect here. If we look at health remote monitoring, if you look at the main components here, which is the cloud services, and also the patient hub, which is what you have at home, which is the sensors connecting to the tablet and channeling it to the cloud, and so on. So if you look at the cloud, so reliability is basically, and stability and performance is basically related to the cloud infrastructure that they serve maximum expected number of clients. In terms of performance, identify any potential performance bottleneck on the server side, monitoring memory consumption, and so on. These are aspect related to the performance. In terms of the home or the patient hub, reliability really, we can look at the reliability. This is related mainly to the wireless aspect that we are using here, like for example, the wireless body area network or wireless personal area network. And here is because of the interference aspect, because many of these, like for example, if some devices, they use the Wi-Fi and the Bluetooth and so on, they are all operates on the same like ISM band, and interference is a main issue. This was one of the problem in this COPD system. This is like few years back, like 2014, 2015, maybe 2016 still. We suffered from interference, because when you test the system in a lab environment and so on, when you take it to a patient home, you don't know where do they live. They may live in a block of flats with lots of, let's say, Wi-Fi or Bluetooth enabled devices. You can't tell the neighbors to switch off this and that and so on. And interference really is a challenging point, because it will prevent the communication. It will not allow the collection of data from the sensors, and this means like there is a problem with the integrity with data at the end in the cloud and so on. The other issue was here, sorry. And of course, I'm not saying interference like a few years back. A lot of things happened in terms of Wi-Fi, a new version of Wi-Fi and the Bluetooth. They overcome some of these issues, but it is still a problem. And basically, with the current evolvement with the 5G and the other protocols that we listed before, which is I'm just kind of trying to get the name. Sorry. Yeah, we listed before. Anyway, so for example, the 5G Internet of Things and so on. solve some of these problems. Not to forget also the energy consumption. Lots of these devices that it gets operated by the Bluetooth, Zigbee, or not the Zigbee really, and the Wi-Fi. Energy consumption is a main issue. If the battery drain very quickly, this will stop communication. This will stop collection of data and so on. So these were the challenges, and evolvement of technology address these challenges in the new version of such technologies. So basically, these are vital quality of service indicators, because this may lead to low adoptions and acceptance by the end user, because this is an annoying feature to have in your system. The other aspect is related to security, privacy, ethics, and so on. Addressing these aspects, security and privacy in Internet of Things, is vital, because to develop trust in using these Internet of Things based systems in the healthcare domain, to trust them, you have to say, okay, it's safe to use, it's secure, it's got all the controller for the privacy preserving and so on. Yeah, and the other aspect here, not to forget, is many of these Internet of Things systems that we bring into the care model, they need to be connected to legacy devices. This is a big issue. How do you deal with the security and privacy aspect when you connect to legacy devices which were developed not based on, for example, if we take the GDPR, for example, principles of privacy, or the current good mechanism for security and so on. And also for privacy needs, these systems needs to be designed with privacy by design aspect, based on the local, let's say, privacy law and local ethics, for example, HIPAA, GDPR. And the other aspect of the challenges we mentioned is interoperability. Interoperability, as you know, is the ability of two systems to communicate and share services with each other. Here in the diagram, I listed the type or classes of interoperabilities. We can say in general, these are technical interoperabilities. If we look at the device interoperabilities, which device that communicate with another device, or device, like for example, a medical device communicate to the Internet of Things gateway. It's related to the networking, interoperability, wireless, wired, what type of protocol or protocol stack they are using. It relates to platform interoperabilities. For example, different platform, they use different operating system, different data structure, different programming language. So these are the technical interoperability is a challenge. The other thing is the semantic interoperability, which is the data formats or the schema. And the syntactic is the data format and the schema. And we have the semantic, which is the data model, and the other aspect related to the ontology and so on. Not to forget here, from the healthcare perspective, is the organizational interoperabilities. Different organizations, they operate differently. How do you make them to talk to each other? So they have different information system, for example, they have different infrastructure, geographical region, and so on. So interoperability is a major issue to enable Internet of Things to work properly. There is a lot of advancement happen in these interoperabilities, but there are so many standards, like the one standard that we have here, which is the ISO IEC 21823 2019 appeared, is basically the interoperability for Internet of Things system framework standard to address difficulty, provide common understanding between, in general, for Internet of Things systems. There are so many challenges. The research challenges, you can call them open research challenges. These are related to, this can be solved by, for example, one of the, some of these open research challenges is like to focus on cross-layer, cross-platform interoperabilities. and to focus for lots of infrastructure or reference architecture for Internet of Things. You've got a layered system. So to consider interoperability, try to address it cross layer. For example, interoperability should be made possible irrespective of the underlying technology. For example, sometimes the device could be not an Internet of Things device. Development of the unified Internet of Things gateway, which is the tablet I did show you at the beginning in the first example that collects the data and channel it to the cloud, should be developed in such a unified way so that can accept future sensors and future communication protocols. And also not to forget, like, how interoperable you made the system. There is a balance between interoperability and privacy or security. The more interoperable, the more you have a problem with the privacy and security. So there's like a trade-off between interoperability and privacy and security. And interoperability challenges, it gets even more difficult when you have a complex system of interconnected Internet of Things. Scalability is another factor here. Again, is if you look at, so for example, scalability in terms of the cloud computing, again, to allow the cloud computer to accept new services and new clients. For the middleware is to allow make it scalable, so to accept new, like let's say, sensors, devices, and new applications. The human factor is another issue which wasn't part of the quality of service that listed was, but it is important. It's basically the usability. It's called usability engineering here. There is a standards here is appeared. This one is it's called IEC 62366 for medical devices. Is basically just to show the designer or developer what are the best practices in developing your system with usability in mind. What do you need to consider? Because usability is very important. Without it, you will have low adoption of the system, because it has to be useful, has to be usable in terms of efficient. It has to be efficient, effective, has to be credible, has to be something that you can use and you can learn and you can use properly and easily. That doesn't affect it doesn't affect your safety as well. And we've seen like usability is an important aspect. We've seen with the latest coronavirus crisis, we've seen like the digital divide aspect. There is some statistics here that 3.5 billion people, it happened based on the coronavirus, because they were trying to use the internet, they can't use the internet. This is an issue. Okay, and how do you design systems that simple, that easy to use for such group? Usability has to be related to safety. It has to be, yes, usability, but it has to be safe. And this usability will lead to acceptability as well. The more is usable, the more acceptable. Of course, from both sides, from the clinician with their heavy schedule, and they don't want to go through different buttons and options and so on, to the end user, elderly, where they need something simple and easy to learn and safe to use. Now, with this, I finish my talk. And here I'm going to give some of, kind of the recommendation here. We said that the Internet of Things, there are so many applications for Internet of Things, e-health, mHealth, you call it, telehealth, under the umbrella of digital health. There are so many of these, and there are a proven impact of these in terms of a better diagnosis, prevention of diseases, drug administration, and so on. The recommendation here is, the society will evolve. I mean, it will evolve, and disease will evolve, as we've seen with the coronavirus. You will have new diseases with new characteristics. The society will evolve. And technology will evolve as well. And accordingly, you will see like a different new system in place under the umbrella of digital health for new scenario that, without this evolvement in diseases or society or the new technology, will not be a reality. Not to forget the role of the AI and big data. Will have a big, now currently have a big role, but will have a bigger role. For example, to personalize a treatment plan for individuals. And there is also a lot of work in terms, okay, AI and big data for health used for personal treatment. There is a lot of, let's say, issue related to privacy, trust, and so on. And you can see there is a lot of regulation from globally, from the EU, from the UK, from the NHS about trustworthy AI and so on, and fair use of data and so on. Now, if we say these challenges we discuss, will it stop? Of course, it will not stop. These and ongoing issues. New performance aspect will appear, reliability. Always it's a catch-up game, like in terms of security and privacy, interoperability, and not to forget the human factor. And also there is a need for standards. I mean, there is a lot of things in the market, like, or in the literature, or, you know, everywhere. There is a need for standards. So for example, there is this standards that I'm involved in, which is basically is clinical Internet of Things for data device interoperability with TIPS. TIPS stands for trust, identity, privacy, protection, safety, and security. So kind of how do you design an interoperable system with all of these in place? There isn't, you know, like developer and designer and manufacturer, there isn't something that they can't follow. There is bits and pieces here and there. Research community needs to continue reporting on the benefits and challenges and lesson learned, so we can learn from it and we can adopt it to provide better systems for the future. And finally, there is still continuous need for the policymaker and government support, both in terms of the actual structure, infrastructure, and of course, finance aspect. There is a need for these as well. That's all from me. Sorry. Many thanks for listening. This is my email. I just want to mention, like, if you want to look at this, more, read it as an article or something, this is based on my latest articles that carrying the same name, which is from the JSAC journal and from the IEEE Access, if you want to have a look at. Thank you very much, and I'm ready to take questions. Yes, just in time, I think.
Thank you, Dr. Philip. I think before we go into questions, you deserve a minute to catch your breath, and I'll ask everybody to can unmute themselves. I'm not quite sure if they'll be able to, but I wanted to thank you for your presentation today. Very, very insightful. We have some questions, but I think once we get going, we'll probably get more. I've got a couple myself as well. So the questions we've had, first one was that you've had some statistics and facts in your slide 5, and the question is that just the UK, or what's the
Okay, if I go to slide 5, sorry, I can't remember. I need to go into this really. Some of these statistics are based on the WHO reports, which is basically global. And some of these statistics is from the latest journal on the Lancet. I must admit, I haven't looked at where they are based on, but I believe it's global.
Okay, thank you. And the next one was, and it's something that has come through my mind as well, in terms of what's the current state of Internet of Things for digital health remote monitoring systems market, and is this application in service?
What is, sorry, I couldn't get your question. Sorry, could you repeat it?
State of this technology, and is this in service anywhere in a either complete or some fashion?
Well, you've seen some examples, like based on like from the last 2 years, based on the COVID-19, we've seen this like hospital at home on virtual wards. This is based on Internet of Things, like you have sensors and connected and so on. I would not say that there are, like, for example, if you look at the UK, there are some places, like, I'm not saying there's been adopted fully, but there are some, let's say, healthcare organizations, some regions on a limited scale, they adopt like such services, but not in general, no. So as I said, we've seen it over the last 2 years. Is the policymakers really, they have to, the benefits are, the impact and the benefits of such system is there, but unless you have the push and the financial and the support of the policymakers, it cannot be a reality globally or nationally. But there are some, and there are lots of research work, of course, and even over Europe as well.
And if I was to ask, is there any country that's got the lead and closest to actually having applications?
I think there is Sweden, you can say. I've seen a lot of this has been in place. Holland. These are the countries, like I can see that they are adopting it as a service, as a clinical service.
Thank you. And the second part of the question was, how will this acquisition, I'm assuming it means the technology and the application of the technology, benefit the end users? And it makes me think, who are the end users? Is it the medical professionals? Or?
No, the end users in my scenario that I worked with are the patients.
Right.
It benefits them because I know for a fact from the pilots that I was involved in, having the feel that somebody is looking after them, somebody is like looking at their signals or just monitoring them, they feel like that somebody is caring with them. They feel happy about it. Yeah, they like it, kind of.
Thanks for that. And there's a question about the slides. Would you be happy to allow us to distribute the slides?
Yes, I just need to, I can send it to you guys, and then you can distribute it. That's fine.
We'll make this available to those who have registered to attend.
Yes.
And the next one from an anonymous attendee: do you foresee new regulations being introduced, the likes of GDPR and ISD, for IoT, especially for their use in critical sectors like health services? How do you protect people's data? What's an ISD?
Sorry, the ISD.
NISD. I understand GDPR, but NISD.
I can't see it. If you can put it in the chat. But for the GDPR, this is in general, of course. So basically, but GDPR is also it is in general. But when you design and develop system, you need to take it basically and try to embed these, which call them privacy requirements, within the design of your system. So, for example, things related to consent. How do you embed consent within your system? Things related to integrity, things related to accountability, things related to like sharing of data and so on. So basically, GDPR, it's got lots of let's say how to use it, lots of documentation on how to use it. to make sure that these kind of requirements is embedded within your system from day one, from the design. Because these, like for example, for the privacy requirement, these requirements are, you know, at the end of the day, could be like it should be part of your design. So for example, if you take the consent, for example, as an example, how do you include it? Of course, you take the consent before they start using the system. You will be using the system. The data will be, you know, stored securely and so on. But to embed that within your system is a must. So for example, if I give you the example of the COPD project, when we were monitoring the patient's, let's say, signals with the wearable, with the vest, there was a microphone to listen to the chest when they cough. And the microphone will listen to the other conversation, of course. So to go by the GDPR, of course, we took the consent from the beginning. We said to them, okay, by the way, this will monitor your voice for 5 minutes a day and from this time to this time and so on. But that's not enough. GDPR is about reminding them about the consent. So before, for example, we take the listening of their chest, there is a pop-up screen, the pop-up message has to appear to the user, say, look, by the way, in the next 5 minutes, we'll be listening to chest. Do you still consenting for that? So they have to say yes or no. So having this pop-up message appear, this is part of the design of the application itself. So these privacy requirement needs to be looked at from the beginning, let's say based on the GDPR, if you are working in another country on HIPAA or whatever. This needs to be considered and design the system accordingly. Yeah.
There's a follow-up as well. One aspect of it is the security of the data. And the other aspect is the integrity of the devices in terms of the accuracy of the information they convey. And the question is, what do you think should be done by manufacturers to fully secure the embedded software or firmware built into their devices? Because wrong information, the wrong decisions may be taken, and there's a safety aspect to this as well.
Yeah, integrity is very important, because I'll give you an example on top of that. So for example, again, from the same system, which is the COPD project, when we were collecting, for example, the data from when we were sending the data from the tablet at the patient home to the cloud, when you are at patient home, we rely on their Wi-Fi, and the Wi-Fi may drop at any time. So the tablet has to send the data to the cloud for the integrity purpose, because this is like data collected and it's needed by the decision support system and to generate the alarm or to generate whatever the alerts. And now what we've done there to make sure of the integrity, and we had to store, like when we collect the data. Another thing I want to say here, like when we were collecting there, we were not allowed to store the data on the tablet, because the tablet is at the patient home and anybody can access it, for example, and we didn't want that. We wanted to collect the data and channel it straight to the cloud. But because of the integrity issues, and there is a purpose for this, we had to store the data temporarily inside the tablet to make sure that the data arrived at the cloud, just in case that there is a problem with the Wi-Fi, you know. And then once it's okay, it's arrived to the cloud, then delete that data. So kind of with this functionality added to our design, kind of we are ready for to resolve the integrity issues. So again, resolving integrity is about looking at your system and think about all the possible scenarios that integrity will be hammered, and how do you solve it?
I think maybe the question also was looking to whether you believe this will be a regulated technology that will require some kind of homologation or certification before you're able to put it on the market. Many It has got a concept of safety integrity levels, where you have independent assessors that are certified by government bodies to actually issue certificates of compliance or conformity to certain stuff. Do you see this?
Yeah, I believe there should be a standard. Just a certification to say yes, it's certified. This is good. It's good, like, is looking after all the aspect of, let's say, for the GDPR integrity, consent, whatever. That's why we were involved in this IEEE clinical Internet of Things data and device interoperability standard with tips. We want to come with a support for the manufacturer of medical devices on what are the steps that you take into account to preserve these things, for example, integrity, or in terms of security, or consent in terms of privacy, and so on, or other factors related to safety or trust, and so on. So I believe there will be a standard appear. That's why we have this. We are working on 2 years back. We should finish it next year, and so on. And I'm sure there are some other initiatives in place.
Thank you.
There is a need of standards, of course, because there are so many things you don't know how to, like, as a developer, as a designer, I can't just take the GDPR and say, okay, I'm going to design this. There must be some sort of standards that you need to follow. And again, to get the certification as well.
Yeah, and we had a clarification on the NISD, which is the Network and Information Security Directive for critical national infrastructure, with a goal to enhance cyber security. So I have learned at least one more thing today.
Yeah.
There was the last question I've got here is on whether interoperability is ensured at which level in Internet of Things, and how?
Interoperability, you should look at it at all the levels. I mentioned the classes that we looked at. I mentioned the classes of interoperability. It could be device-to-device interoperability, network interoperability, platform interoperabilities, semantic, syntactic, organizational interoperability. You need to make sure that you satisfy. If you say generally interoperability, you need to go deep into it. What are these? What are the interoperabilities classes? And try to design it based on these classes. So basically, you have the system end to end. So this section is good device to device. This section is good platform to device. And then between device to device, there is the aspect of semantic and syntactic, because they will be communicating data. And So basically, you need to break it down into the different classes.
Thank you. I suppose interoperability, you've mentioned it quite a lot. It will be a key factor to the success of the technology, because we need to have early on standards that various suppliers have got to work to. Otherwise, it becomes anarchy, and the biggest companies will establish their own standards, and you lose interoperability. So
Absolutely.
do you see this something that can be helped by regulation again, and do you see it happening?
I would not say regulation. I say by standards body. People who are by standard bodies, really.
Okay, thank you. And in terms of whenever you introduce technology change, there's another aspect in terms of the maturity of organizations, and in this case, it will be the National Health Service in the UK, to adapt to benefit from the introduction of this technology. Is there any thinking about the technology introduction and how the health services will adapt to benefit from it?
I think there is a thing based on this 2019 NHS long NHS plan, and based on what we've seen through the COVID, and I'm sure they will be considering, getting into that maturity model for the digital health to become part of their care services.
Because suddenly we're going to have a huge amount of information available to health professionals who can provide advice. Are they going to have their time to adjust? And how do they do that? Which is something that I suppose it's the soft change that needs to come with the technology change as well.
Yeah, absolutely. It's, do they have the time to look and to take into account a new system in place, or how do they deal with all this information? Who's going to look at these patients who are monitored at home? And again, it's about a change in the model, in the care model, the model of the healthcare service, and accordingly change the structure of it, that can allow this system to be used. And again, design it in such a way that is useful to these, it's beneficial to these healthcare professionals. They can see that there is a need into it, so they can use it. And many of these people are very busy and they don't want the change. And again, is to find let's say ways of engaging them and get them interested in this. So yes, definitely there is a lot need to be done here. From both from the policymakers and from the people themselves, from the user themselves, to accept it, and from the technology providers as well.
And is there any further work being done about integration or expansion and inclusion of AI into the information? I mean, there will be a lot of data being gathered, and if it's difficult for humans to deal with it, will there be AI technologies that will automatically message you a cure?
Yes, of course. I mean, these systems, they have an AI with it, like there's decision support system to support this. There is an AI with it. Sorry, I didn't understand your question. Sorry, could you repeat it so I can answer it?
Trying to visualize in an ideal world how it would be used so that it doesn't overburden the medical professionals. So that, how do you separate, how do you get technology to respond to the majority and the more common inputs that you get, so that the medical professionals can concentrate on what needs human intervention?
Yeah, I mean, they're already using electronic health records, isn't it? When they are, like, for example, reporting on the patient's, let's say, outcome or providing treatment. They are already using such systems, and should be like something that this, like, decision support system could be integrated to that electronic health record. And instead of, like, for example, give this particular medication for this diabetic patients based on the well-known factors, maybe I can consult this AI or my ML tool to tell me, is this really right for this person? Because not all medication works well with all the patients. So maybe it could be part of the electronic health record and other functionalities that they can, run and get some answers by entering the patient's, let's say, characteristic, demographics or, details like age or BMI or whatever, for example.
Okay.
Yeah, it could be part of the electronic health records.
And we have a couple of questions that have come in. What's the difference between machine-to-machine communication and Internet of Things, are they interchangeable, or is there a distinction between these two?
Machine to machine, it could be within the, for example, there is the device to device and there is the machine to machine. It could be like within the device itself, you have different, like, let's say, subsystem within that, and machine to machine that communicate within the device. Like it's a smaller scale, let's say, machine to machine, as compared to, let's say, device to device communications. It could be within the machine itself.
Okay, and I shall take the last one. It's intended for me, but I'm not quite sure I've got an answer. It's whether by the use of AI in healthcare, was I alluding to augmented intelligence as opposed to artificial intelligence? If the latter, what could be the risks? I'm not quite sure.
Yeah, I mean, augmented one is still to come. Is not. I think it's still in the research. Let's say it will come at the end of the day, but it's. I'm talking about the normal, like AI related to machine learning.
Of course. Well, I haven't got any more questions, and we've already had you for nearly 2 hours now with us. So I'm going to pass over to Matt. Matt, are you still here?
Yep, still here. I'll just reshare my screen. Thank you very much, Dr. Phillips. That was a really interesting talk. I had loads of questions myself, but the questions that we did have were actually far more interesting to most people, I think, than the ones that I did. So thank you very much again. I'll just put the slides back up that I did right at the start so that people can see the upcoming talks. So just a reminder that at the moment we've got a talk coming up on Friday, the 28th of January, on cellular metal with extreme cutting resistance, and that's an in-person event for those who can make it and want to see what it's like to be back in person again. And then at the moment, there's a to be confirmed talk on March the 9th about cities post-COVID and their pandemic future. And we'll keep you informed on the likelihood of that going ahead. So we will be emailing you a feedback form for your completion. Thank you very much for attending. And if you do have any comments or questions, please feel free to post them on Twitter or on the IET London Facebook network. Thank you very much, and yeah, hope to you all come again to the next talk that we're giving. Thank you.
Thank you.
Thank you, Dr. Philip.
Thank you very much. It's my pleasure. Thank you for everyone listening.